Good morning, everyone, and welcome to the CAD Exchange call. My name is Michelle, and I will be your moderator for today. Feel free to ask questions throughout the presentation by typing them into the Q&A box on the right-hand side of your screen or dialing *6 to unmute your line. If you would like to zoom into any part of the slide, use the magnifying icons on the right-hand corner of the slide. The slides and a link of the recording will be provided within 1 week. I will now turn the presentation over to Lonnie. Lonnie, the floor is yours.
Good morning, everyone. This is Lonnie Dinh. I am Regional Vice President of Quality and Systems Improvement for the Southwest affiliate of the American Heart Association. It looks like there's a small enough group of us we can just do roundtable introduction. So if you wouldn't mind coming off mute and just state your name and your role and then the facility that you work at, that would be great. And to come off mute, you hit *6.
Hi, I'm Holly Williams. I'm the chest pain coordinator at Washington Regional Medical Center in Fayetteville, Arkansas.
Good morning, Holly.
Good morning.
Hi, this is Megan Fry. I'm the quality coordinator at St. David's Medical Center in Austin.
Hi, I'm Marty Chivo. I'm the chest pain coordinator at Hendrick Medical Center in Abilene.
Good morning, Marty.
Good morning. This is Brenda Watson. I am a clinical data abstractor at Texas Health Resources for Fort Worth, Denton, and Plano.
Good morning.
Good morning.
This is Greta Harris, data coordinator in Hot Springs, Arkansas at CHI St. Vincent.
Good morning.
Good morning, Lonnie. This is Pooja from the AHA I'm on.
Good morning, Pooja.
Morning.
Anybody else able to come off mute to introduce themselves? Hit *6 to unmute and then *6 to mute yourself again. Okay, let's go ahead and get started. Pooja Patel has joined us. She is the Senior Manager for Hospital Accreditation and Certification at National Center, and she's going to spend a few minutes talking, providing some updates to us. So we'll open up the call with Pooja. We know that this group is oftentimes bringing the latest information back to your cardiology team. So
We might have lost Lonnie. Pooja, do you have slides, or would you just be verbal?
No, I don't have slides this morning. I can just give a verbal update.
Perfect. Then go ahead and you may go.
Oh, sure. Thank you. And I'll be brief. So thank you so much for having me on the call today. I can't see everyone that is on from the WebEx, so I'll give more of a generic high-level overview. I think Lonnie was starting to share with you that there are some new developments as it relates to some of our work in quality and systems of care, particularly in the area of accreditation and certification. And I oversee all of our accreditation programs and certification programs for cardiovascular disease and stroke for the American Heart Association. And I think some of you that I did hear introduce yourself are probably from hospitals that are accredited as Mission Lifeline as a designated or accredited STEMI receiving or STEMI referring facility. There are several hospitals across the country that have achieved our accreditation or in the process of working on accreditation in order to meet state requirements for designation or regional requirements for designation, as STEMI is, a time-critical a condition that we really focus on in our systems of care efforts. And I'll give just a quick background or an overview in case some of you may not be as familiar with this program. And if you're not, I think our local team will be happy to give you more information. I'm more than happy to provide some resources after this call. We do have a website at www.hart.org/accreditation that you're more than welcome to visit as I'm sharing some of these updates. But we have, as part of our work in Mission Lifeline, which originated now over a decade ago, we have since been enhancing our work in quality and systems, not just for STEMI systems, but stroke systems of care as well. So I'll start with that because our journey at the Heart Association and our role in accreditation has really been evolving since 2002, 2003, when the American Heart Association first published our policy and guidance for what would be an ideal stroke system of care. Since the Heart Association did that, our quality programs and solutions not only get with the guidelines and Mission Lifeline, but we formalized accreditation because our goal was to create and make available quality programs and solutions that we could offer to hospitals as a one-stop shop with the Heart Association and our local teams that offer quality and systems improvement services to hospitals. But we, as a result of the work in systems, we have since now over the last decade and a half created, launched, and been managing different levels of stroke center certification programs, and that was all in collaboration with the Joint Commission. We have not traditionally been administering these accreditations and certifications ourselves. And a big part of that as we evolved was the development and the creation of this Mission Lifeline program for accreditation, which launched in 2011. And we have since, there's over 60 hospitals across the country that have achieved accreditation, and we're working with several more that are in the process of either renewing or becoming a new accredited facility. We have not, the AHA has not traditionally been administering this accreditation. Independent, we developed and launched it and we outsourced it, meaning at the time it was a society of chest pain centers that we were working very closely with because this accreditation was very much aligned with the work that you all do in your chest pain program, which, as many of you probably know, has since evolved, as the society grew and morphed into the Society of Cardiovascular Patient Care. And about a couple years ago, they were acquired by the American College of Cardiology, and we announced that the work that we would be doing in the cardiovascular space, separate from stroke, would be with the ACC for a lot of different reasons. We wanted to harmonize the work that we not only do in guidelines and in development of performance measures, but also in Mission Lifeline accreditation, because we really wanted to find a way to reduce data entry, reduce duplication, reduce confusion, that we were offering as solutions to hospitals in the market. However, and unfortunately, recently the ACC, I believe you all are probably familiar with this, but the ACC decided publicly to no longer work with the American Heart Association as it relates to quality. This applies to Mission Lifeline not only for participation in registries, which, get with the guidelines. CAD is very much our new solution, but that also applies to accreditation and certification programs. So we have been working, very diligently since we received this news from the ACC to make sure that it does not negatively disrupt or affect the important work that all of you are doing in quality and Mission Lifeline, and more importantly, in the work that you're doing every day to deliver quality patient care to your patients. So we have, in June, really shared with all of the sites. We sent out communication directly, so I hope that you've received it. Letting all of you know that if you have accreditation and if it's current, we would continue to, honor it and work on your renewal process as you're coming up for renewal on our own. And there are several sites that submitted their applications but were not able to process, that the ACC was not able to process in June. So we're currently working on renewing those sites that are in queue. I share all of this with you because now that I have my list up, I'm seeing that several of you are from facilities that are either accredited as Mission Lifeline and or chest pain centers by the ACC. So if you have questions, we do have support locally and at the national level. Lori Hollowell, who you might have worked with in the past, her and our national team is really working to make sure that everything that all of you have been doing will continue as is and uninterrupted and not disrupted for the foreseeable future, because first and foremost, our priority, like I mentioned, is quality and systems, and we will continue to offer those solutions with hospitals regardless of whether the AHA decides in the future to continue to do this independently or with partners, but regardless, we will be sure to provide you updates and more information. But that was the first part of my update. And the second thing, which is still very premature, but because the local team has given us the opportunity, to share this with you on this platform, I wanted to let you know, and I hope that by now you've had a chance to see this, but we also announced, because to my earlier comments, we really still have a goal to reduce confusion, duplication, and all the number of options that hospitals have in the market as it relates to your quality and accreditation needs. We have expanded, thankfully, and we're so excited about it, expanded our collaboration with the Joint Commission to really mirror the success and build off of the success that we have in stroke systems of care, because we've certified now over 1,400 hospitals as different levels of stroke centers. We've been able to successfully launch and implement policy in over 24 states for an ideal stroke system of care, and as part of our Mission Lifeline involvement, we are in the process of enhancing what would be an ideal heart attack system of care, because that is probably, as I hope you all are nodding and agreeing with us, that is long overdue, and there are several states that are developing, some similar levels of care in their own state protocols and are looking for guidance from the American Heart Association. And we're really excited to be working with our committees and our volunteers to develop and enhance what an ideal heart attack system of care is, and what that in turn would mean to the solution as it relates to chest pain, Mission Lifeline, and this really this heart attack accreditation that we have available. So we're in the process of exploring that, developing that out further, really understanding what all the regional levels look like, whether it's in urban areas, suburban areas, rural areas. And so I hope, all of you really feel empowered to give us feedback, ideas, some challenges that you're working through with EMS, with your local hospital association group or state health department. We are just now beginning all of this exploration, and hopefully in about the next 18 to 24 months, you'll hear more updates and developments as we look at how we will plan to enhance this accreditation program by leveraging all 60 plus, hopefully more, hospitals that we have already accredited as leaders, and helping us really define what an ideal heart attack system of care is. So for those that are already accredited, we thank you and appreciate all of the work you've done and continue to do in accreditation and Mission Lifeline and in with your participation in Get With the Guidelines CAD. And we really hope to work with you to continue to develop and enhance that further to meet our systems of care goals. So I'm sorry I didn't have any slides. A lot of this is still very much in development, and so hot off the press updates, but I appreciate Lonnie and Larissa, the platform, and the opportunity to share this update with the group. I hope that Lori is on, and Lori, if you are, I will ask if you want to come off mute and if you want to add anything, or if I might have missed anything. Otherwise, Lonnie or Larissa, if we want to open it up, if there's any questions before I hop off, I'm happy to take those as well.
Hey, Pooja, it's Lori. I'm on. And again, thanks, Lonnie and Larissa. I just want to say that this, I'm excited as well about this opportunity with the Joint Commission. While we're working towards, creating the program with the Joint Commission, I think our Mission Lifeline semi-accreditation program is still very robust. It still has a lot of value as far as systems of care development. If you haven't seen our new version of the requirements, I would suggest going on our accreditation website, and Lonnie, y'all might want to just provide the link to that website and just review our Mission Lifeline accreditation benefits, and then complete the information form, and we will send you a copy of the requirements. One of the main focuses that we're doing with accreditation and with Mission Lifeline overall is we know there's a deficit in the referring hospital patients. So the patient, not that they're doing anything wrong, but the patients that are transferring for PCI, I guess is the best way to say. We know that that patient population is still not meeting the guidelines within 120 minutes of first medical contact at the referring hospital. So we're really trying to put a focus on referring hospitals in the eye of the receiving centers. So if you're a receiving hospital, you will now see the referring hospital requirements side by side for accreditation. And the same thing with our recognition one-pagers. Everything that a receiving hospital needs to achieve, we're putting the referring hospital achievements as well, so that the receiving hospitals understand what's being asked of the referring hospitals, and the referring hospitals have that same understanding of the requirements and achievement measures of the receiving centers. So we're really excited about the new approach. The requirements have been clarified. If you had an old manual, the requirements have been clarified a little bit more. The provided guidance or supporting guidance, we are taking those statements directly from our circulation and science, our circulation and science papers. So I hope that you find it more organized, more clear, and if there are any questions after you receive the manual, just let Lonnie know, and I'm happy to work with you as well if there are any clarifications needed or any questions.
Thank you, Lori. Thank you, Pooja. Yep. So, any questions, you can hit *6 to come off mute if you have a question for Pooja or Lori. We're so glad that they were able to join us this morning. Thank you.
Yep, happy to take questions.
And Michelle, are you able to see if there's any questions in the chat box?
There are currently no questions in the Q&A box, but if you, just a reminder, it's on your right-hand side, and you're able to ask questions, and I'll go ahead and read them out loud.
Okay, so it looks like we don't have any questions.
Lonnie.
Oh, go ahead, yes.
This is Marty. I'm sorry, I was driving and I'm not logged onto the computer, but I'm about to. We currently have our AMI certification through the Joint Commission. So do you know when to expect what would be the criteria to do this accreditation?
Yeah, so we do have the criteria available, and we can just send you a form that you fill out and submit to be able to receive the criteria electronically.
Okay. Okay.
Yeah, and Lonnie, I just want to mention too, there's no charge for the criteria now. So since June 5th, since the separation with ACC, you know, we're not charging for the accreditation criteria.
That sounds good. I'll get with Katie. Should I send it to Katie?
Yeah, or you'll need the form.
Okay.
So I can just send that to you when we close out today.
Okay, sounds good. Thank you.
You're welcome. Yeah, so the manual that you used to have to purchase is essentially what you receive, and we're no longer charging for that. You just submit your application and receive it. Any other questions? Okay. All right. So if you think of something later, just feel free to shoot us an email, and we'll get it to the appropriate people and get your questions answered. And again, thank you so much, Pooja and Lori, for being on this early morning with our affiliate.
No problem, Lonnie, and thank you for having us. And if anyone does think of any questions, you know, Lonnie and I work closely together, so Lori and I can work to help answer your questions at the local level. But thank you for having us. I'm going to go ahead and hop off now unless there's anything else.
Okay, sounds good. Thank you.
Thank you.
All right, so I want to spend time showing you all of the reports that you're able to run and get with the guidelines, coronary artery disease. And but before I start, and I'll do a demo, so if you're able to log into the webinar, you'll be able to see, catch a visual of what I'm showing. But I wanted to, before I jump into all of that, I want to just open it up to any other questions that anyone might have. We want this time to be just very informal, and you know, if you have any questions or comments about anything, feel free to hit *6 and come off mute. Okay, so we'll jump right in. So Michelle, would you confirm that you're able to see my screen?
Yes. And
Okay.
you are unfrozen.
I'm sorry?
I can see that you unfroze the slide.
Perfect. Okay. So I'm in a demonstration site, but this should look very similar to your view once you log into the module. You know, you've got your tab on the left-hand side that allows you to go into, you know, enter your patient. This is where you check for your notifications. So anything that's going on, like if you're experiencing an outage, this is where you're going to be able to go in and just see any updates or anything that has been updated or anything that they're working on the platform. And then the library, there are so many really, really helpful documents in the library. So here's where you can find your user manual, your coding instructions, a printable form of the data collection form, but also all of your measure information is here. And so if you're wondering, okay, what data elements are they looking at to pull, you know, for a specific measure, you'll be able to find that information here. There's also some training videos and a little bit of report information here. So just a great place to go, and you're always going to find the most current version of anything that we have in this in the library. So the operational reports is where you're going to go when you want to pull back any information into report format, or even if you just want to export, you know, all of your raw data. So this feature has recently been added, and it's really wonderful. If you want to just export everything, you can go into the data download report, and you can select what you want. You can select all, or you can select, you know, like if there's something in particular you're looking for, you're just going to scroll through and select it here, select your date range, and you can export it into an Excel spreadsheet. So I'm going to just pull up one that I did earlier so that you can see what that looks like. But this is a nice way to be able to manipulate any of the information that you entered into the module. So where you have all of your data elements and fields for every patient that you've entered. So I know you don't probably do that very often, but sometimes there's something that you want to look at specifically, and that's a good way to do it, to get it into an Excel. And then I also wanted to point out the predefined reports. So you're able to, if you have something that you're looking at over and over again, you can go into the configurable report area and save it, and then you'll be able to pull it up. So I'm just going to do one for you. So let's do, I'm going to go into measure reports. So let's do your mission lifeline measures, because I think that's what, for recognition purposes, that's what a lot of people run on a regular basis. So I'm just going to select my time frame, and let's just grab Q1 to Q3. And then if we come to achievement measures here, you can select all of them, but I frequently am just pulling the mission lifeline measures. So your ACE and R, your smoking cessation, and I'm going to select those for receiving facility, aspirin at arrival and discharge, beta blocker, your first medical contact with EMS to device time, and I want my overall composite, primary PCI or door to balloon, and statin. And those are my mission lifeline measures. So what I'm going to do is save it and give it a name. So I'm just going to call it my mission lifeline measures for recognition. And that way that next time I come in, I can go to my predefined report and just select the measures that I want and the time frame that I want to look at. So just an easy way, if you're pulling something over and over again, an easy way, like let's say you're monitoring your first medical contact to ECG, and that's like all you want to pull, and you're tracking that closely, and so each time you come in, you can just, you can just give it a label, and you can delete these, you can edit them, so you can just play with this and make the reports what you want them to be. You cannot break anything in the report section. Just click around in here and play with it, and you're not editing any patient information when you're in the report section. Once you've entered, if you've edited a patient, it'll refresh overnight, and so that patient will fall into your report the following day. So I'm going to run that report, the Mission Lifeline report, for this year. I want to see how we're looking for Mission Lifeline recognition this year. And the apply parameters, really, it's the same as run report. So you just click apply parameters. And here you've got your Mission Lifeline information. So I want to point something out in case you're not all familiar with this, but as you scroll along, you're going to get details about, I'm going to close. What's nice about this is you can kind of make this screen, I'm going to collapse that window and just make this screen view what I want it to be. So you can move these bars around so that you can see more or less of the information in each of the sections. Let's say I don't want to look at my case list. I just want to be able to see my numerators and denominators here. So total patients entered, this is quarter 1, 2, 3. For ACE and ARM, and the total patients entered is here, and then the patients that fell into the numerator and denominator of each of the measures will be here. Your exceptions are listed, and then you can see your percentages here as well. So you've got it in both kind of a graph format as well as this, or like a table format as well as a graph format here. And then to be able to print this, you're going to click on this little hamburger icon right here. And you're going to click export. And let's do this report in, you can do it in whichever format is, you know, you like to work in. A lot of times if you're taking a report into a meeting, you want it in PowerPoint, you can export it into PDF, or you can export it into the EPAM format, which I really like. But let's do a PowerPoint. And we want, let's say, all of the pages in the report. And then it took me a while to figure this one out. Maybe you guys are all way ahead of me. But for a while I couldn't figure out how to print more than just the one, the page that I was looking at. But if you click on trellis panels and table rows that are not visible on the screen and hit OK, that's going to give you everything, not just what you're looking at in your screen view. I'll show you what that looks like. I really like this. And then you can edit the PowerPoint as well. So it's going to pop in the bottom of my screen. And here you can see that you have all of the pages of the report in your PowerPoint. And you can also show you what it looks like exported into an EPAM report. It's essentially an Excel. So here I've got my measure details in an Excel format for each of the measures, and my measure summary here. And it's going to, let me show you how to, let's look at the case list for, let's find some fallout. So let's say, this is always a tough one. So you can pretty much click anywhere in here to get your case list to display below. I can click here. I can click on my numerator and denominator. And here I've got my patients that fall into that measure. And then I can, I'm going to make this bigger. I'm sure this is really hard to read in your view. But you can also, this is the first medical contact with EMS, to device measure. And this is going to provide you with some of the detail here. But to be able to go into the individual patient case list, you can just click on the link and it'll take you directly into the case. You can sort by denominator and numerator so that you can really easily, get to your fallout and see, who's in your denominator but who's not in your numerator. And that way you can click in easily and see, like, what was going on with that patient. Did you forget to put, like an EMS non-system reason for a delay, like if the patient was a cardiac arrest in the field or something like that. So, and then also, if you want to look at that, I'm clicking here on the hamburger icon, going to export, and I'm going to export this into Excel. I'll show you what that looks like. And sometimes it's a little bit easier to look at the information in your Excel format, but here you've got your case list in Excel format. And you can sort here in Excel like you would, you just click Enable Editing and sort. I'm going to pause there and just see if anybody has any questions about what I've been showing. I know it's a lot. Also, I know that many of you are way more computer savvy than I am. So if you have figured out some things, some fun ways to run reports, please feel free to share with the rest of the group. No questions? Everybody's got this. Okay, I'm going to show one more thing since we have time. So what's nice about this system is that it allows you to really dig in and track things in multiple different ways. So, like, you might have a physician who's asking, like, okay, well, how are we doing compared to the rest of the country on, say, door to balloon or EMS first medical contact to device? So that's the kind of thing you can use your benchmarks for. You can take a look at, all of the hospitals or, just academic facilities, accredited facilities, just, the hospitals that are in your state, just STEMI receiving centers. So this is a way for you to select, to be able to compare so that, you can take it back to whoever's asking the question and let them know, how you stack up to everyone else. The other thing that I really like is if you're having difficulty with a particular measure, like let's just say, let's do an NSTEMI measure. Let's say you're having difficulty with your dual antiplatelet therapy, but you want to track it by physician. So you can track it by attending physician or your physician interventionalist, and you can just go in and select the physician and pull a report in that way. You can pull it by EMS agency. So let's say you want to look at your first medical contact to device time for, if you have 2 or 3 agencies that typically transfer patients to you, and you want to look at that for the year and see how you're partnering with a particular agency on that measure. You can pull it that way. You can pull it by day of the week. You can pull things by mode of arrival, you know, air ambulance or walk-in, diagnosis. So this allows you to really drill down and pull different information and measures in a more specific way. Your quality measure, I just want to point out, is one that if you're not meeting that quality measure, this is also called the plus measure. It's not going to keep you from recognition, but it allows you to receive a plus, kind of a gold star recognition that's added to your baseline recognition. So if you're meeting your Mission Lifeline measures and you're meeting your quality measure as well, then you receive like a gold plus or silver plus or what have you. But this is the time at the first facility, the referral facility, to device within 120 minutes. You can pull it by just the things that a STEMI receiving center would be interested in looking at, or a referring facility. Okay. Any comments? Any questions? Let's open it up to questions or comments about anything else, anything related to Mission Lifeline or Get with the Guidelines, coronary, the module itself. Okay, quiet group today. Okay, any questions or comments before we close out? So you'll hit *6 to unmute yourself, or you can enter questions into the chat box.
Hi, Lonnie. We do have a question. When will the optional fields be available to pull in a report?
Yeah, good question.
Hey, Bonnie, it's Lori.
Yeah. Hey, Lori.
I'm still on. Do you want me to take that?
Good. Yeah, that's great.
So, unfortunately, I don't have a definitive answer for you, but we are working with IQVIA. We had a conference call yesterday, as a matter of fact, talking about putting that up to a very high priority item, because we completely agree you're using those fields, but there's no use in those fields if you can't pull the data out. So we are working with IQVIA, and Lonnie, check back with us. Joe's going on PTO next week, so maybe the beginning of the week after, and we might be able to have a more definitive update, because I know we're talking to IQVIA again today. So we definitely want to get that. We want to get that for our users. Absolutely.
Thank you, Lori. Yeah, I love the optional fields. For those of you who aren't using them, there's 50 optional fields. So I don't know if you remember, and on the old platform, I think we maybe had 4 optional fields, so you can really track all kinds of information in the optional fields. Anything else? And any other directors that are on have any comments or advice for report writing? Anything that I forgot to cover? Okay, so we'll go ahead and close out. Once again, thank you so much for joining this morning, and thank you, Lori and National Center staff, for being on to provide updates about accreditation. Please reach out if you have any questions, or if there's anything that we can help you with, or when you go in to run your report, you're like, oh, I forgot how she did that. Just get in touch with your regional director, and we'll help you out. But I appreciate everyone taking the time this morning to join us, and hope everybody has a great Thursday. Take care.
Great, Lonnie. And we actually do have praise from Julie. She writes, I wanted to thank all you guys for your help helping me several weeks ago. So beneficial. Thank you for letting us know we could help, Julie.
Thanks, Julie. All right. Take care, everyone. Bye now.
Thank you, everyone, for joining. We'll go ahead and send out the slides, the forms, and the link to the recording within a week of this conversation. If you need any additional help, feel free to contact your directors or contact Lonnie. Thank you all for joining. Have a wonderful day.
Thank you.